overwhelming majority of plastic surgery patients were women. Now, while that is still true, the number of men having such surgery is on the rise. Ted Garcia joins us now with part 2 of male plastic surgery. Yes, it was certainly a fascinating one because you did it yourself.
Right. Yeah, and we're going to show you even more tonight. You know, it's hard to believe, but just 3 weeks ago, I was one of those patients that we're talking about. Now, the main point of this story is to let men know that plastic surgery is indeed an option for them. Tonight, my recovery and the final results. For men of all ages, ethnic backgrounds, and income levels, plastic surgery is now more than ever an option.
There's a big increase in men getting plastic surgery. It used to be that only the movie stars would do it. It was thought of almost as taboo. And then a few years ago, we started getting more men coming up to us in the gym and saying, you know, look both ways. What can you do about this problem or this problem? And it was always very hush-hush. Okay, now removing the fat.
So far, Dr. Brent Moelleken of Beverly Hills has taken fat out of my cheeks and has done some liposuction under my chin. Now, it's time for the chin implant. They come in different sizes, which the doctor and staff try out.
Great, we've got our nice chin there, and that's resulted from the test implant being put in. Test implant's in place now, it went in very easily. We're just going to make absolutely sure that we feel it in the right position, which we do.
About 4 hours later, the surgery is finally over.
Everything went great, you're just waking up. Everything went perfect, Ted, you're just waking up now.
After a brief stay in the recovery room, it was off to a place that was once thought of as a retreat for women only, an aftercare facility called Shanti. It's a place where patients are pampered and cared for by a well-trained staff 24 hours a day. About 20% of the patients here are now men.
Hi, Ted.
How are you?
Good. How are you doing?
Feeling great. Only 4 days after the surgery, the bandages come off, and Dr. Moelleken assesses his work.
And it looks great. It looks wonderful.
So here it is, before and after. A subtle change that will last me for the rest of my life. And you know, a lot of people have asked about recovery time. Doctors recommend 2 weeks to heal before you go back to work, even more if you can. I took a week off and was okay. Now, if you'd like more information, you can contact Dr. Moelleken at drbrent.com. And I have to thank Tom McCosey, my photographer, for not passing out in the office.
Isn't it true, though, that the healing time or recovery time depends on what you have done? I mean, or how extensive.
Very true. Yeah. And if you actually rest during your recovery time. If you go out and go speedboat racing or something, you're not going to recover as fast. You've got to be a good patient.
I have to ask you, what's been the response from people when they see you? Do they know immediately that something's different? Or?
They say, you look more like Donny Osmond, and how much weight have you lost?
Really?
That's a big thing now.
Does anybody not notice at all? I mean, are you surprised by people who just don't say anything?
A lot of people say it's just a subtle difference, and that's exactly what I was going
I imagine that they're thinking something's different about you, but they don't want to say anything.
Exactly.
Well, you haven't changed. You look the same. I mean, you look great, but it still looks like you, which is good.
Thank you.
Which is important.
Okay, Donnie, it was very...
Donny Osmond. Well, still ahead.